We are thrilled that you can join us today. And if you are new to the Connecting Kids to Coverage national campaign, I just want to say that we periodically do host webinars like this one. We try to feature outreach and enrollment resources, and we often have guest speakers that will address timely issues regarding messaging, challenges, best practices that you all may want to incorporate in your outreach and enrollment work. If you have been a partner for a long time, thank you for joining today's call. We are really excited about highlighting the resources on InsureKidsNow.gov. I'm going to pass off to Jessica in just a minute. But before I do that, I did want to not just thank everyone for joining, but I would like to especially acknowledge the attendance of our new outreach and enrollment grantees that were funded under the Healthy Kids Act. We have 39 grantees that received awards under the Healthy Kids Act for 3 years of their Connecting Kids to Coverage work, conducting outreach and enrollment activities at the community-based level. Those 39 grantees are across 25 states, and they consist of providers, states, tribal entities, and other types of community-based organizations. And we are delighted to have them join today's national campaign calls and our calls going forward. And with that, I am now going to pass off to Jessica Boschman. She is a health insurance specialist in the Division of Campaign Management in the CMS Office of Communications, and she is going to provide an overview of all of the many rich and wonderful resources that we have on Insure Kids Now for reaching those uninsured eligible children and their parents. Jessica?
Thank you very much, Amy, and thank you everyone for joining our webinar today. We're going to talk a little bit about the Connecting Kids to Coverage national campaign, partnerships, our website, InsureKidsNow.gov, initiatives, tools and resources, and we'll open the floor for questions and answers. And as Amy mentioned, we have a variety of experience levels with the campaign on this call, and we're really glad that you joined us today. Next slide, please. So we're going to start off with a poll question, and we just want to get to know the folks that are on this call. And if you will look to the right of your screen, underneath polling, there's a question there, and it says, which options best represents the areas of your organization serves? And if you are serving a particular state or region, we'd love to hear from you, and if you can click all that is relevant. All right, looks like the time is up. All right, I don't see, oh, okay. All right, so we have a variety of areas, and a lot of folks that are from Florida and Georgia and Kentucky, Alabama, Mississippi, and Illinois and the Midwest. So thank you very much. We're just trying to get to know all of the folks that have joined us. Thank you. Next slide, please. Okay, so the Connecting Kids to Coverage national campaign is a national outreach and enrollment initiative which was established 10 years ago to find and enroll uninsured children and teens, eligible children and teens in Medicaid and CHIP. Through the campaign, we let families know who is eligible for Medicaid and CHIP, what benefits children can get, and how to apply for coverage. And a big part of what we do is we work with trusted national and community partners like yourselves, and we create, customize, and distribute a variety of outreach materials, and we're going to really dig deeper into these materials throughout the webinar. Next slide, please. So our campaign priorities, we have really targeted back to school as a key moment in time to enroll kids because we know that this is a time where families have annual physicals in mind, and it's a time where vaccinations as well is an important part of enrolling in school, and so it's part of a parent's to-do list. We also emphasize year-round enrollment as well as other school-based outreach opportunities, because we know that that's where kids are engaged in activities, and oftentimes they need to be insured to participate. We also are underscoring that more parents and other family members may qualify for Medicaid too. And in addition, we're focusing on hard-to-reach populations. So over the years, there's been an increase in enrollment in Medicaid and CHIP, but there are still some areas where it's been harder to get the information out to families, and so we're really relying on our partners and other organizations to help get the word out. Next slide, please. So we're going to have another poll question open up. Which audiences does your organization serve? So we've got some answers here: children and teenagers, parents and caretakers, school-based organizations, nonprofits, community groups, professional associations and groups, and others. And if you are serving another, if you wouldn't mind sharing what other audiences as well in your response. All right, so we have a few more seconds here. And we really appreciate your responses. Thank you very much. All right. So let's see what our audiences are like. Okay. So the bulk of the groups that are participating in the webinar today are serving parents and teenagers, and children and teenagers, and parents and caretakers. Great. Thank you very much. All right, next slide, please. So we have, throughout the course of the campaign, we've engaged with a lot of different partners, and our partnerships are really instrumental in extending the reach of the campaign. There are partnerships at the national level, at the regional level, state level, local level, real grassroots as well, and all are very important to what we're doing. Some ways that we've engaged partners has been hosting webinars, or the ways that partners have engaged with us. They've hosted webinars, or they've been part of our webinars, posting information and videos on websites and social media, publishing newsletter articles, sharing materials with state chapters, members, and more. And in addition, many groups that we've worked with have customized and distributed campaign outreach materials. They've also sponsored outreach and enrollment activities, worked with media in their local areas, and provided application assistance for children with families with eligible children as well. And we'll talk a little bit more about the customizing of materials a little bit further on in the webinar. Next slide, please. So InsureKidsNow.gov is the campaign's website. It is our go-to source for all campaign information. One area of the website is the Find Coverage for Your Family map. That is an area for consumers where consumers can go and click on the state, or and then they'll be connected with local information that's relevant for their area. In addition, families can call 1-877-KIDS-NOW, the hotline, and also get information. We also have a section on Insure Kids Now for all of our different initiatives. We have a very robust outreach tool library, and we are constantly adding new information and new resources to the outreach tool library. Webinars like this are posted and are archived and posted on the website, as well as other videos. And then we also have our Campaign Notes e-newsletter, which we send out invitations to webinars like this. You may have received the information through the Campaign Notes e-newsletter. We also send out other information periodically about new resources or information about grants and other useful information about Medicaid and CHIP outreach and enrollment efforts. Next slide, please. So here's just a screenshot of one of the pages on InsureKids So you can see at the top there's that purple bar where on the left is that find coverage for your family area that I mentioned. We also have a section for just general campaign information, that outreach tool library, the third from the left, the webinars and videos, the Campaign Notes e-newsletters, and then the initiatives. And so under initiatives is where you'd find the back to school and school-based outreach page. So this is just a sampling of what you'll see on the site. Next slide, please. So for initiatives, we have focused on specific topics and audiences. We have, as I mentioned, back to school information, multicultural outreach, oral health, because February is Children's Dental Health Awareness Month. We have some specific information around that. Youth sports, year-round enrollment, and rural communities. We also have themed resources as well. And we're always looking for ways that we can expand on this. So if you have any ideas, if you see something that you've been working on that we haven't quite touched on yet, we would love to hear from you, because this is an area where is constantly growing. Next slide, please. And we have another poll question. So speaking of initiatives, what initiatives that we currently have information on our InsureKidsNow.gov website are most relevant to you? And if you have if you have any ideas or other areas, again, we'd love to hear from you. So we'll just give a few seconds more for you to fill out responses to this question. Thank you. All right, great. Oh, fantastic. We've got a lot of folks that are interested or have been doing year-round enrollment and rural communities. Wow, great, and multicultural. This is fantastic. Thank you, very helpful. Next slide, please. Tools and resources. So under the outreach tool library, we have a screenshot of just the top of the page here. You can find our print outreach materials. Many of these resources are customizable, the posters and palm cards. We also have fact sheets as well. On the top of the page is a customization guide. And in that guide, you will see step-by-step instructions on how you can request customization for free from designers that work at the Centers for Medicare and Medicaid Services. So we look forward to hearing from you. It takes about 2 weeks to turn around these requests, but please fill out the request as it's listed in the guide. It's really important to do that, and our designers are ready, willing, and able to help. We have many languages available for our posters and palm cards. We have been adding new languages because we have heard from organizations like yours that there's a need for specific languages. In fact, we're adding Russian and Farsi materials to our outreach tool library in the very near future, and that was a specific request that we heard. In addition, you'll find some earned media tools and resources. We've got ready-made articles that you can take the information and put into a bulletin or a newsletter. And then we also have live read radio scripts, which can be sent to radio stations, but we've also heard of organizations that use them for on-hold messages or public address announcements. So there are different ways that you can use them, and if there are ways that your organization has been using our tools and resources, we would love to hear from you too. Next slide, please. So we've got another poll question here. And just going back to the languages that we have for our resources. What languages are relevant for outreach in your community? And as I mentioned, if there are languages on here that we haven't yet added to our library, we are especially interested in hearing from you about that. Okay, just a few more seconds. Great, great. Okay, so that's not surprising that English and Spanish are by far the most popular. But wow, Farsi is high up there, Arabic. This is really helpful. And let me see if there are any other languages. I can't see what the other languages are in the response, but hopefully we can, at the end, if Porter Novelli, if you can just share what the other languages are, I think that would be helpful for everyone. All right, next question. Sorry, next slide. Toolkits and tip sheets. So on InsureKids Now, under the Outreach Tool Library, you will find a variety of toolkits and tip sheets. We have our Connecting Kids to Coverage National Campaign School-Based Outreach and Enrollment Toolkit, which is a great resource for how to work with the school. And you'll find a lot of really helpful information. And it's not something that's necessarily tied to back to school. You can actually use information in this toolkit throughout the year. We also have our oral health resources, tip sheets on how to work in rural areas and in cities with local businesses, primary care associations and community health centers, and the faith community. And I just wanted to note that our tip sheet on how to work with cities, that actually came about through a partnership that we have with the National League of Cities. And so it's a great example of how we were able to combine the experience and resources of our two organizations to put together a really nice resource, a how-to resource for grantees and partners and other community-based organizations. Next slide, please. So I mentioned that our material can be customized for free by using all the step-by-step instructions that are in the customization guide. And this slide just shows you what specifically you can customize on our resources. So you can add your program name, your state's annual income eligibility limit for a family or household of 4. You can add your website and or phone number and up to 2 logos. So as I mentioned, it takes about 2 weeks to turn around these requests, and we're very happy to customize these for groups. Next slide, please. We have our public service announcements. They are radio and television public service announcements. The name of the spot is called Covered. The PSAs have been distributed nationally, and they're available in English and Spanish. We've extended the use of our public service announcements through June of next year, and we know that stations across the country are using these public service announcements, and you may have heard them on the radio or seen them on TV. You can also view them and listen to view the TV spot or listen to the radio spot if you go to the Outreach Tool Library. They are featured there. We have some additional tools around public service announcements. We have a pitch letter and live read script. So with the pitch letter, if by chance you haven't heard the PSAs airing in your community, you can kind of nudge stations in your area to use them if that's something that you're interested in doing. So there's just some information on ICANN on how to do that. Next slide, please. We also have a variety of digital media tools, and this is an area that is ever evolving. We have a variety of social media graphics for Twitter and Facebook, and we have a guide on how to use these. We have web buttons and banners and sample posts as well. But we do add to this pretty regularly, and then we also have a lot of images that we use on our Twitter handle at IKN.gov as well. Next slide, please. So for the outreach video library, that is our area where we house best practices. We've worked with a variety of organizations to really showcase some of the great work that organizations are doing. We are looking to add more videos to our library, and so that's where hearing from organizations is really helpful, because it's our best way to know what folks are doing in their local communities. We also have our webinar archive, where this webinar, as well as all of the other webinars that we've done recently, are housed. So if you have any colleagues that weren't able to join today and they would like to listen to this webinar, it will be posted within the next month. And you can also search the webinar for ideas on topics that we may have covered in the past. And back to school is definitely a big one for us. We also have webinars on rural outreach, social media. There's just a variety of different topics. And again, if there are other topics that you'd like to see us do in the future, we would love to hear from you. Next slide, please. So we've got our last poll question for the webinar. I know that I've talked about a lot of our campaign resources. We're interested in hearing about what resources that your organization finds most useful in your outreach and enrollment efforts. And it could be resources that that you are currently using, or resources that you're interested in using in the future. We look forward to hearing from you. Thank you. Just a few more seconds. All right, great. Thank you very much. Let's see. Okay, so posters, flyers, and palm cards are most useful, as well as customizable materials. Fantastic. And social media content. Okay, great. Well, thank you very much. Next slide. So here's how you can keep in touch with the Connecting Kids to Coverage National campaign. You can follow us at Twitter at IKN.gov, and we tend to use in our posts hashtag Enroll365, Kids Enroll, Medicaid, and CHIP, and we encourage other organizations to do so as well. You can sign up for our campaign notes e-newsletter if you're not already a subscriber, and you can always reach out to us at the connectingkids@cms.hhs.gov email address. Next slide, please. All right, and so now we're going to open the floor for any questions that you may have. And I'm going to turn it over to Porter Novelli. I know that they have been, they're our outreach contractor that we work with on the campaign, and I know that they've been monitoring any questions that have come up, so I'm going to turn it over to our team there.
Thank you, Jessica. And we'll allow people a little more time to ask questions as well. It looks like we've been receiving a lot of very state-specific questions, and we encourage you to email us those so we may direct you to the appropriate resources for those. And as a reminder, if you're trying to get in touch with the campaign or Jessica or Amy, the contact information are in the slide deck that is going to be made available following this webinar.
I see that one attendee said that mentioned another language. So thank you for that, Emily. Emerick?
And then we've just received a question about customization of the materials too, and whether they need to include a formal approval statement as per the notice of award appointment. So yeah, once you submit the form to customize resources, it's going to include any necessary disclaimer statement as well, and we will work with you to make sure that everything conforms to your agreement as well.
And just to make sure that everyone has the contact information, it's connectingkids@cms.hhs.gov. And that email address is also on the website. And then thank you very much, Judith. So if you also would like to contact Amy or myself, here is our contact information. Oh, so we have a question about how soon the radio PSAs will be ready. They are actually available right now. If you go on to InsureKidsNow.gov under the Outreach Tool Library and click on Public Service Announcements, you can find the files there. And they are for use until June of 2020. So we have another question about language being available. We'll look into whether, or we have a couple of other questions I see about that. So we'll look into these additional languages and whether or not we can translate into them. We work with a contractor to do translations, and they are well versed in a lot of different languages, but I'm just not sure about all of these languages that are mentioned. All right, are there any additional questions, Judith, or are we all set?
Those are all that we saw come through.
Okay, well, thank you everyone for joining this webinar. We really appreciate your time, and we look forward to hearing from you and working with you in the months to come, and hope that you have a wonderful afternoon. Thank you.